Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 23rd, 2020, bringing you back-to-back videos pertaining to COVID-19. And I was searching for information to bring to you guys pertaining to COVID-19 and stats and said information. And this was one of the latest articles I found that was relayed on Tuesday, April 21st. Dayton Daily News. Coronavirus, Black death rates disproportionate. DeWine launches Minority Health Task Force. As the coronavirus pandemic continues to ravage the country, including the Dayton region, the death rate for Black people is disproportionately higher, according to Johns Hopkins University research and the Centers for Disease Control and Prevention. Of the 26 states that have reported coronavirus deaths by race, Black people account for nearly 34% of the fatalities, according to Johns Hopkins. Ohio is not among the states that Johns Hopkins is tracking. But as of Monday afternoon, 14% of the COVID-19 deaths in the state were Black, according to incomplete data from the Ohio Department of Health. Black Ohioans make up 14% of the state population. In comparison, 70% of people who have died from the virus are white, according to ODH. 21% of the total people with COVID-19 cases in Ohio are Black. And given the virus's impact on minority groups, Governor Mike DeWine announced Monday that he has formed a new minority health strike force. We must recognize that there are many Ohioans who have an increased risk of being disproportionately impacted by COVID-19, and we must do everything we can to protect all Ohioans from this pandemic, DeWine said. The disparities in the death rate can be attributed to several underlying factors that have historically plagued the Black community, said Dr. Karen Matthews, Executive Director of Health and Psychological Services at Central State University. The factors include limited access to health care, living conditions, socioeconomic conditions, and chronic illnesses such as high blood pressure, hypertension, and lung and heat diseases, she said. Some of that is genetic and familiar, but a lot of it has to do with having access to good medical care to be able to participate in preventive maintenance, if you will, said Matthews, a family physician who spent more than 30 years in the United States Air Force Medical Corps. But if you don't have transportation to go to a doctor, or if you have a job that may not be flexible to allow you to make appointments, you're not going to be participating in that prevention piece. And then once the diagnosis of the disease is established, then there's that intervention piece. There are more than 777,000 confirmed COVID-19 cases in the United States, and the death toll was 41,344 Monday afternoon. The state of Ohio is reporting 12,919 cases, with 509 deaths since the outbreak as of Monday evening. The total number of deaths include the CDC's expanded definition of 18 probable cases, according to the Ohio Health Department. Across the country, including Ohio, race data for COVID-19 cases have been incomplete. Part of the issue is that when COVID-19 patients are being admitted to the hospital, they don't include their race on the admittance forms that created a 30% data gap in Ohio several weeks ago. Dr. Amy Acton, Director of the Ohio Department of Health, and Ohio Governor Mike DeWine appealed to people to include their race on forms when they take loved ones to the hospital. It paid off, as the data gap is at 21% as of Tuesday morning. The federal government and some universities have recently pushed to better track COVID-19 patients by race in recent weeks. The CDC launched a nationwide surveillance system to track COVID-19 related hospitalizations, including by race and other factors. They are also collecting data from death certificates, which will help agencies officials know the numbers and percentage of deaths by race in different geographic areas of the country, said spokeswoman Kate Grusick. Johns Hopkins data shows that while Black people represent 13% of the population among the states that have reported racial and ethnic information, African Americans account for about 34% of total COVID-19 deaths. The CDC collected data from 10 states that have had at least 100 deaths and found that nearly 19% of people who have succumbed to the virus in those states are Black. In addition, Black Americans represented 33% of hospitalizations, despite only making up 18% of the total population studied, according to the CDC. The COVID-19 normally affects the lungs, but it can also affect all organs, said Matthews, a Dayton native who served at Wright-Patterson Air Force Base just before she retired from the service as a colonel. So while the virus can kill all people, regardless of race, those with a history of underlying health conditions tend to have a more difficult time fighting it off. She said, Black people tend to have a history of hypertension, diabetes, asthma, lung disease, cardiovascular disease, she said. In some cases, Black Americans don't know they have these conditions until it's too late. They don't have access to health care. But when they do learn about their health conditions, they are unable to practice preventive care for a myriad of reasons. Matthews said, they may not have transportation to go to the doctor, or perhaps they have jobs at which they don't have health insurance. Nutrition also plays a role. People who live in food deserts don't have access to fresh fruits and vegetables and aren't getting the proper amounts of nutrients and vitamins, she said. And so often, many segments of the African American community, not all, but many, are in urban areas or in really, really rural areas where there are food deserts, she said. Some Black Americans who are aware that they have these underlying health conditions risk their health because of economic reasons, while others have the option of working remotely. Some Black people may have blue-collar jobs that doesn't allow them to work from home, so they have to expose themselves to the virus. Living condition is another economic factor, and it makes it difficult for some Black people to practice social distancing, Matthews said, noting that she prefers the term physical distancing. If you got someone who, for whatever reason, is living in a small house or a small apartment and they're responsible for other persons in that abode, how easy is it for them to practice social distancing? She said, it's very difficult. It can be very challenging. Data has pulled up for years showing that not all Ohioans have the same opportunity to live healthy lives, said Reem Ali, Vice President to Health Policy Institute of Ohio, which provides nonpartisan guidance on health policy. Ohioans face consequences of both historical and contemporary racism and discrimination, she said. Historical policies and practices like redlining are going to have residual impact on Ohio communities of color and lead to poor health outcomes. But even the biases recorded within the healthcare system can also have an impact on some of the disparities that we're seeing. Black Ohioans have 2.9 times worse rates of child poverty compared to white Ohioans, 4.7 times more likely to attend a high-poverty high school, 2.7 times worse rates of unemployment, and 1.4 times more likely to be uninsured, according to Ohio Health Value Dashboard, published 1 year ago by Health Policy Institute of Ohio. In addition, are 1.6 times more likely to be unable to see a doctor due to cost, 2.9 times worse rates of infants who die before the first birthday, which is also considered an indicator of broader health stressors, and 1.3 times worse rates of adult diabetes, the Institute said. These accumulating effects of opportunity, assets, and health outcomes can fuel gaps in health conditions, which now seem to be contributing to gaps in who is hit hardest during the COVID-19 pandemic. We just saw national data that was coming out linking long-term exposure to air pollution to increased risk of death from COVID-19, and Black communities have higher exposure to pollution, Ali said, giving an example of how these gaps in health and social conditions can fuel gaps in the pandemic's impact. That is the said information from the Dayton Daily News. And underneath at the end, there is a promoted stories, coronavirus cases in Ohio. And it gives, I guess, the counties in Ohio with the said positive cases. Okay, sorry, that was a bit winded. So this was just an article giving you some information pertaining to the Black community. As you see in the past couple of weeks, there have been information related to the public that more African Americans have been affected by the disease and fatalities. As I state, you can agree to disagree. You can believe whatever you choose to believe. But as they state, certain reasons are why people are affected with health problems in the first place. Economic reasons, not having medical insurance, not having a way to the doctor, poor diet, health, vitamins, and so forth and so on. Access to a doctor, because there are some African Americans who do live in rural parts of America. Some people probably don't believe that, but there are rural communities where African Americans do live, and they do not have access to a hospital, doctor, clinics, and said medical facilities. Also, with the white race as well. I think most of us know that. I brought you this video because of something I noticed yesterday. And I'm going to intertwine it into this video if you can hold on and bear a moment with me. I was out with a friend and her mother yesterday. We went out to the store, and naturally I was masked up. But we took a ride so the mother could get some air because she stays in a lot. We're inside of a vehicle. And I noticed people hanging out on the street, sitting out in front of a said person's house, a whole bunch of their family members, acquaintances, whatever. Sitting out, no mask. I didn't notice anyone with a mask. You go up a couple of yards, guys hanging on the street corners, hustling, selling the drugs, getting high, you know, all that type of BS. And it was sad to me. It was sad that these people do not, these African-American people, let me say that. These African-American people sitting out amongst themselves with no mask on, no gloves, sitting beside a person, swinging their feet off a vehicle, hatchback, side of a car, trunk, hood, whichsoever, talking to people, laughing, spitting, coughing, knowing that there's a damn deadly virus out here, knowing you all have health problems, most of you, possibly some of you, and you're right up in these people's faces as if nobody is dying from this disease. Why are you all sitting around each other in houses, apartments, unnecessarily, knowing that this disease is killing people? Why are you standing and sitting on street cars and street corners, huddled under each other like Eskimos for no apparent reason, knowing there's a deadly virus killing people? Standing on the street corners, getting high, looking for the drugs, selling the drugs, making your quick money, knowing there's a deadly virus out here killing people. Spitting, sloughing off under folks on the public street to gather because you're bored, to gather because you want to get high, with whatever reason you were standing out there on that street corner, that sidewalk, in front of somebody else's house. Y'all get my drift. Why? And somebody I noticed the other day, just as stupid as a bag of rocks, got health problems, overweight, stupefied, holding a beer, and want to hold a conversation as if it's a joke and say, pointing up to the sky, "You got faith, don't you?" Look, Negro, I don't need nobody telling me nothing about no faith. And as I stated to that person, don't think because you're newly baptized you want to give advice about faith and standing there holding a beer too. Bye, Felicia. Or as I would say to him, bye, Tito. You see how stupid people are? Stupefied, misdirected, ignorant. This is an all-in-all video. So if you hear a little bit of this, you're going to wonder, well, why is you tying this in here? I'm tying it all in here. Black Americans are being affected by this disease. Whether you believe the stats or not, it is what is coming out. So I'm going to believe it. Who am I to argue? People are not taking the disease serious. White, black, Asian, tall, short, fat, young. People still walking around in the stores without masks and gloves on. African American people are being affected because obviously they're stating we have more underlying conditions, which is sad. And it is sad that every time something pop off, it's always the black demographic that is affected the most. It's always something with poverty. It's always something with crime. It's always something with not having enough education, not enough food, not enough work, uneducated, not enough jobs, not enough adequate housing. It's always affecting the black population. HIV, AIDS, that was an issue. Still an issue here in the South. More AIDS and HIV cases are here in the South, for those of you who do not know that. Yes. And it is a pity and it is a shame that the African American race has more problems. And when something goes bump in the night, we seem to always take the brunt of the situation. I'm saddened. I'm saddened because it is true that certain things will cause you not to get adequate health care Get the help you need. If you, one, don't have medical insurance, you don't have a car, you don't have an adequate job, you can't take off from work. If you take off from work, you got to have a doctor's excuse. It's always something to hinder you from getting better, doing better. And most people work themselves to death just so they can eat and survive. And along comes health problems in doing so. And now they've got to try to find a way to pay for the doctor's visits, x-rays, medicine, all of the above, and keep a job and a roof over their heads. It's rough out here. But I say this to all Americans, whether you're black, white, or whomever. The disease is here, it's prevalent, it's relevant, whether you like it or not, whether you want to believe that it's relevant, prevalent or not. And I say to my fellow African American people that the stats are showing that we are more at risk because we tend to have more health problems than the average American, white American, non-Caucasian. But I also believe it is also affecting others as well who do not have underlying conditions. So if you care anything about yourself, wear your mask and wear your gloves. If you're going to stand out on the street corner and hustle and sell drugs, put a mask on and gloves. You're handling dirty money. Did you not know that? Literally. Y'all know where I'm going with that, right? Quit playing. If you're going to get high and chase the drugs, put a mask, gloves on. This is for everybody. But let me tell you something before I check out of here. This is for the dodo birds out there. Don't ever try to tell somebody why they shouldn't wear a glove or mask, why they should have faith in God. God gives you the wisdom to know the difference, if you know that much, if you want to quote Bible scriptures, while you're standing on the street corner drinking a beer. And newly baptized. Let me throw that in there. God gives you wisdom to have common sense to know better. And if you are hearing and seeing of a disease, ravaging people, killing people, making people ill, why don't you take heed instead of being a fool and giving ill advice and being stupefied and spewing out religious commentary? How about worrying about yourself and your family members? And the fact that some of you are still, as I state, hanging on street corners, hanging on people's front porches, hanging on sidewalks, running in and out of people's houses, knowing they have elderly people, children, babies in there. You really don't have no reason to be in their house. Why don't you stay out of their houses? And why don't you people stop letting people come in your house? I don't care if it's your mama, your daddy, your sons, your brothers, sisters, whomever. They don't pay no rent there. They need to go stay some damn where else. They can video chat you any day of the week. And those of you who have elderly parents and relatives, you know you don't have any business running in and out of those people's houses all the time, carrying that virus in their house. That's common sense, that's logic, and it's called respect. Truthfully, it's best that we all stay in our own homes, that we really should not be visiting anybody, going in their house, even with a mask on, gloves, or without. And if we want to visit, we best sit 13 feet apart. Because this virus is taking names, and she don't care nothing about us. Black, tall, short, fat, white, Asian, 5-month-old baby, 5-year-old baby, 14-year-old kid. Corona does not care. This is a sad world. This is a very sad world. And the most disturbing part of this world is that the virus is still circulating, and some of you are still walking around as if you are in a bubble and acting as if you cannot be affected. And you black folks need to stop being so damn ignorant and oblivious to the fact that the virus is here. And this goes for white people too, because I've seen all of you in Walmart with no gloves, no mask, and looking at everybody else like we foreigners in the store. No, honey, you the foreigner. Because you're the one that's going to be coughing and hacking and miserable because you didn't want to listen. And you didn't want to take advice from health officials about your own damn health. And you've risked passing the virus to others, receiving the virus from others, because you want to be hard-headed. That's my message today. Like, share, subscribe, drop your comments below. Thanks for joining me. God bless you all, stateside and abroad. Wash your hands. Keep your hygiene up. Stay safe, America. Stay home if you can. This is Everyday Shenanigans. Thanks for joining me. Bye-bye.